All right, and there you have it. So welcome, everyone. Thank you for joining me on a Saturday night. You know, if it were me on a Saturday night, I'd probably be at a bar or a club somewhere. But you guys are here with me studying, preparing for interviews. So I appreciate that. And I'm here to make it worth your while. Okay, so I'm Kevin. I'm a second-year medical student now. By the way, today we're going to focus on the MMI preparation and the interview day. If you've attended anything similar to this, talk that we've done before, this one's going to be different because we have a rapid fire high yield ethics section at the end, which we've only presented once in our TMU webinar. So if you weren't at that, this is going to be a lot of new stuff at the end. But yeah, about me. So I'm a second year medical student now. Slide needs to be updated. But I was accepted to many schools across the US and Canada, including McMaster. I interviewed at McMaster twice. And the first time I was waitlisted and, kept waiting, and nothing came back. The second time I got in from the get-go, okay? And my MMI was very strong. How do I know? Because my CARS score on the MCAT was pretty weak. It was like 127, so relatively weak. Now, if you have a 127, you need your interview to be almost perfect to make up for it, okay? Well, my GPA was great. So, due to that weakness of my CARS score, I need my interview to be really, really good to make up for it. And well, that's what I did. Had a good interview. If you're applying to the US or have any questions about that, just feel free to drop in the chat. Towards the end, I'll have a Q&A. So this presentation, we call it The Secret to the MMI. And what is the difference between a great answer and an extraordinary answer? All right. Now, MMI, it might have changed a little bit, but McMaster 2 years in a row, it was like this Zoom-style format using, I think, Cura Talent. So there was someone across the screen for me. It was a new person every time. I think technically they weren't allowed to tell me their name, but at the beginning, I always asked, oh, with whom do I have the pleasure of speaking with? Oh, my name is Dr. Egan. I don't know. Oh, Dr. Egan. And I'd make it a point, remember their name, and at the very end, okay, thank you, Dr. Egan. I'd say that at the end. Just, it shows that you're able to remember their name. But sometimes they're like, oh, I'm not allowed to tell you my name. I had that happen once. It's whatever. But anyways, yeah, you're given a prompt and an answer. I'm not going to bore you guys with this. So when it comes to preparing for these interviews, you got to be very familiar with hot topics relevant to healthcare in Canada. So that's, the opioid epidemic, homelessness, barriers to care, social determinants of health. And this is, it's a good list of stuff to just get started on learning about before you hop into your interview. Have some sort of nuanced opinion on these topics, right? You claim, you as a med school applicant, you're claiming that you want to be this, a doctor. Well, there's a lot of responsibilities and roles that come with that in terms of your position in the community. So you're expected to have an opinion at the minimum on things like this. Whether you've done any activities in them is a separate discussion. But here's the thing: the first cycle I applied, I'd be really good at this stuff, but I didn't really think too much outside the box, okay? But time and time again, on interviews like my McMaster interview, okay, I can't confirm or deny anything, but I'd be asked some crazy questions out of left field, like, what's your opinion on racism, okay? So take a look at this list. These are simply issues, hot topics that are affecting people on a day-to-day in Ontario, in Canada. It's not necessarily directly healthcare related, right? Like the wealth gap, cancel culture, physician burnout, recent bills, housing in Ontario. But these are all, you can consider almost everything healthcare adjacent, right? If you can't figure out the housing crisis, then it becomes a matter of public health. So you see the point? So you could really be asked on anything, because as a future physician, you're expected to be a thought leader in your community. That's my interpretation of it, which is why I think they need you to really have some sort of nuanced opinion on all of these topics. So I can't tell you how many times I've been asked about things like burnout, huge. I've been asked about the wealth gap. I had an interview in Canada. I can't say which school, but they showed me a map of the world, and it was like the wealth distribution within the world. And it's like, what's your take on this? I was dumbfounded. I didn't get into that school, but hey, have an opinion on the wealth gap. Okay, so you could be you could be asked about that. Mid-level providers, so that's kind of like a not politically correct term for physician assistants, nurse practitioners, basically individuals who can, are approaching the level of autonomy of a doctor. So in Ontario, for example, pharmacists can prescribe now, as of last year, up to 11 different medications. So you don't have to go to your family doctor for some sort of medication design, like the antihistamines. I forget the exact ones, but there's a role in not having everything done through the family doctor, right? So look into that. Immigration, refugee health. I mean, it's a huge topic right now with immigration in Canada, international medical graduates, and so on and so forth. And even weird questions like, is war good or bad? Like, you could be asked stuff like this. So please read broadly and don't think, okay, well, this is a medical school interview, so I just need to know about these topics. There are some things that students like get super infatuated with, like organ donation. And maybe even last year, like, I mean, personally, I researched that. I've never been asked about organ donation. Okay, so I mean, there are rabbit holes you go down with stuff like that. I'm going to save you guys time because I'm going to give you a really high level summary of 20 different things. But I mean, there's some like weird stuff students get infatuated with. You're not going to be asked about organ donation. At least I don't think you will. So I think the best way to learn is through practice. So let's do this practice question together. Imagine you're a physician and you encounter a patient with chronic pain who requests opioid medication. How would you balance the need for effective pain management with the risk of opioid addiction? All right. Now let's look at an answer to this question. I would conduct a comprehensive assessment of the patient's pain. Okay, that's how we're going to start. Then you're going to say, I would have open conversations with the patient about their pain experience and treatment history. If opioids are necessary, I would proceed with caution, starting at the lowest dose to avoid dependence. I would revise the treatment plan with the patient periodically, which means I'd regularly review it and adjust as needed. And lastly, you'd get a conclusion. So put in the chat, who thinks this is a good answer? Or unmute. I promise I won't go to the next slide until one person puts in the chat, yes or no, you think this is a good answer. All right, I'm waiting. Ryan says good answer. Okay. Anybody else? It can be improved. Okay. Well, here's the thing. Ryan, I agree with you. I think this is a solid answer. If I told you that a clinician said this answer, right? Some sort of medical professional, would you believe me? I mean, I'd believe myself. I don't think anybody would deny that this is a mature. It's a very simple, straightforward answer, and you hit on all the necessary points. Now, here's the thing. Watch what I started doing the second cycle I interviewed. I went from this kind of answer, which is great. I mean, it's a really great answer. Let's not get confused. But let's see what I started adding. I could first, imagine you say the same thing. Okay, we're going to say the same thing, but we also add these points. I could first explore a multidisciplinary approach to treating pain, for instance, physiotherapy, lifestyle modifications, exercise, or diet. I would educate the patient about the risks of opioid use and how we can minimize these risks to build a trusting doctor-patient relationship. And then imagine, you go into one of these topics here. Maybe you can make connections to the opioid crisis. Hey, every major metropolitan area in Canada is dealing with an opioid crisis, especially Toronto, especially Hamilton. Maybe you could talk about the sickle cell disease. This is a very well-studied topic in ethics, where you have individuals in populations that are affected, more so higher prevalence of sickle cell trait or sickle cell disease, so Black populations, and they'll come into the ER in pain, the emergency room. They need opioids, right, to treat their pain, and then the emergency doc might be like, oh, this guy just wants, or this gal just wants some opioids. So there's an aspect of just a discussion of racism there, so maybe you can make that connection. You could perhaps discuss specific medical cases relevant to Canada or Ontario. You could briefly discuss perhaps the science of opioid addiction. Now, I wouldn't go too far into this. We could say, hey, I took this course on cell biology. These things are very addictive because they act on the mu receptor in the brain, right? They're agonists. And You could talk a little bit about that. And maybe you've done some sort of volunteering or research in the realm of street medicine. So the homeless population, or street medicine. I mean, you can look that up. And you've done maybe naloxone training, right? So this is the opioid receptor antagonist. This is for treating overdoses. So there's a lot of interesting things, whether it's a personal experience you've had, some research you've done, a class you've taken, or just some other, real world event you can pull into your answer that can really add substance and make your answers unique. Because this is what I call a textbook answer. It's not bad. I mean, when in doubt, a textbook answer is better than the average answer, because people, they trip out, they start saying crazy stuff. But if you can figure out, and it comes through practice, if you can pull in some sort of real world event, some sort of personal experience, it really bolsters your answer. So do you guys see the difference here? Just put in the chat, yes or no, you see the difference. If you don't, I can help explain better. By the way, these come, okay, yes. All right. This is what our website used to look like. So these questions come from our opioid crisis question bank. So this is our website, thebrightdoctor.com. This is what our website looks like now, opioid crisis. And we have, the questions and an expert answer for every single question. We have over 300 questions now. So that's just the opioid crisis mini bank. Also, we give ideas to go beyond, red flags to avoid. But anyways, that's just a screenshot of our website. So standing out, why do you have to give these crazy answers? Okay, why? So Ryan, would a combination of two be the best? Yeah. So I said we're going to give the same good answer, but then we're also going to add something from below. Was the idea there? So at McMaster, if I'm not mistaken, around 600 people get interviews. Around 200 will get in, including waitlist movement. It can approach 300. That's my understanding, okay? But here's the thing. All of y'all worked so hard to get here. You worked so hard. I mean, are you going to slack now? You're not. Are you going to say some crazy stuff on your interviews? You're not. But here's the thing. Everybody's doing the same thing. And this is what really made our webinars popular last year, is because I was the first person to say, hey, guys, believe it or not, if you all read the same stuff and do the same thing, you're going to say the same answers. Wow. It was truly groundbreaking of an idea back then. But everybody's reading, the same books, doing right. Is Doing Right a good book? It is a phenomenal book for understanding bioethics. Do you need to understand bioethics to that level of a degree? Like 300 pages of it? No, because you're not going to base every single one of your answers on beneficence, non-maleficence, autonomy, a patient. I mean, informed consent, that's very important. But the thing is, if you start talking like, oh, beneficence and non-maleficence, you're going to be like, dude, what are you talking about? This isn't a bioethics course, okay? In fact, I don't think I'd use those words ever. Informed consent, though, is very key, and I'll go over that. But there's better uses of your time, in my personal opinion. So what are the ways to stand out? And after interviewing 2 cycles, US, Canada, different provinces, different states, I think I've distilled it down to these 5 ways, okay? So I've distilled it down to these 5 ways. It's either addressing more perspectives than other people, which means perhaps you're demonstrating some sort of knowledge. You're offering more alternative solutions than other people, so maybe a creative solution, or how to avoid a certain issue in the future. All right, because a lot of people will solve something, but then if you can say, okay, well, going forward, we're going to have, I don't know, weekly check-ins or something to prevent this problem from happening again, well, that's a way you can go beyond that a lot of people don't think of. Be a better speaker. You're more personable. You have more well-organized answers. You have less ums and ahs, and you look at the camera and you speak with confidence. You make connections to your personal life. So some sort of volunteering you've done. Again, it was an opioid question. Okay, how would you talk to a patient? But you could have said, oh, I've actually done the street medicine volunteering program where we went and, did training on naloxone or something. To your future career, I'll show you how to do that. Or you demonstrate some sort of specific domain knowledge, and I showed you how to do that. And lastly, explain why. So my goal in this presentation is to show you how to do these 5 ways. We're going to hit all of them. I mean, we hit some of them already, but how to pull from these 5 ways to stand out. And this is really the most important slide of the entire deck, okay? Obviously, there's going to be a quick rapid-fire ethics review at the end. But this is the most important slide. We're going to send these slides. Don't bother writing this down. But look at this bullet point, okay? Look at the camera and speak with confidence. I know so many people that are brilliant, but they can't talk. They just can't look at a camera. They can't, stare at the camera while they're talking, and they get nervous. Whereas everybody knows a smart aleck is what I call it. A person who thinks they're a know-it-all, they talk, they know everything. The issue is these people get very far in medical school interviews because they can look at a camera and speak with utter confidence. Okay, so don't let a smart aleck get ahead of you. Practice, I really think as much as 50% of the interview is how you're delivering your message. Should you speak for the full time? Typically, no. Yeah, because you're going to get follow-up questions. I've had like up to 3. I mean, I don't try to ramble. I think it bothers them when you're rambling. It's not like, oh, and I really think, in my opinion, if you miss something, they will ask you as follow-up to help you get it. So if you're going to ramble for 8 minutes straight, you're not going to get that follow-up to help you address that point. Should you go in depth or broad? People ask, okay, well, should I talk about 1 or 2 points in depth? That's what I do. I talk about 1 or 2 ideas in depth, but I acknowledge if there's another perspective, I acknowledge them briefly beforehand or towards the end, especially with like alternative things I could have done. Oh, I could also explore, for example, XYZ, but I think my approach will ensure that, I holistically do something. All right, let's practice another question. Are there any questions for me? No. Okay. If I'm being clear, guys, how does the Ontario health system address the needs of Indigenous people's populations, and what improvements can be made? So I call it health policy. We call it the health policy question banks, right? This is from our Ontario health policy, but it really is just hot topics in healthcare. You're becoming a physician. You should, understand the underserved populations in Ontario and how to best address their needs. So let's look at this answer. This is straight from our website. And I'm just going to put this up here. So we're going to give an intro sentence. So the Ontario health system has made efforts to address the unique healthcare needs of Indigenous populations, though there are still significant areas for improvement. Okay. This is actually an organizing question. Okay. This is an organizing statement because it tells the person you're going to first talk about the efforts that have been made, and then you're going to talk about the areas for improvement. So your interviewer will expect that. One way the system addresses these needs is through culturally sensitive care. This involves providing healthcare services that respect and incorporate Indigenous cultural practices, beliefs, and values. For instance, some healthcare facilities have integrated traditional healing practices alongside conventional medical treatments. And then we talk about that. So we demonstrate knowledge of real-time Ontario policies. Okay. Next. Oh, shoot. The Ontario government has also made efforts to improve access to healthcare for Indigenous communities. This includes funding for programs and services specifically designed for Indigenous populations, such as the Aboriginal Health Access Centers, which offer a range of health and wellness services. So again, we're talking about our real-time knowledge of Ontario policies that are relevant to this population, and we've also talked about here about spiritual well-being and what it means to have a holistic healthcare approach for these folks. However, there are still notable gaps and challenges, right? So we're getting to this second part of our introduction sentence. One major issue is the accessibility of services, especially for those in remote or rural Indigenous communities. These areas often lack adequate healthcare facilities and professionals, leading to significant disparities in health outcomes. Another area for improvement is the training and education of healthcare professionals in Indigenous health. While some progress has been made, there's a need for more comprehensive and mandatory training on cultural competence and historical and social factors that impact the health of Indigenous peoples. And lastly, we're going to say, furthermore, there's a greater need for collaboration, involvement of the Indigenous communities in the planning and delivery of healthcare services. And we basically say, hey, when you're making policies that affect Indigenous peoples, we should have meaningful partnerships and collaboration with their leaders. So we ensure that these initiatives are community-driven and responsive to their specific needs. So this is a very cool, innovative idea. So I'm not going to just tell you, how does the Ontario healthcare system address the needs? What improvements can be made? Not only do I answer this, but I also, offer innovative ideas. If you notice, if you're very astute, if you're a scholar of the CanMEDS pillars, this is actually one of the CanMEDS pillars, which is shared decision making. Did I use the word shared decision making. I mean, I could have, but the thing is, this answer incorporates that as a value. And it's just because of a very mature frame of problem solving that you have is like, hey, let's, do some shared decision making if we're going to make policies that impact indigenous populations. And lastly, our website gives you, ideas to go beyond and red flags to avoid, right? Like, don't overlook the historical context of indigenous health disparities, because there were things like residential schools, like forced sterilizations. I mean, there's so many directions you could go to build a background on why this population is underserved, from medical distrust, because of this residential schools, forced sterilizations, and so on. And yeah, that's what we bring in, the go beyond section and avoid. So were there any questions with that? Yeah, Zobia, it's being recorded. We're gonna show you how to access the recording at the very end. All right. So yeah, Dana, what's up?
Hi, sorry. I did have a question about, I've gotten a lot of recommendations to integrate more personal connections to the topic at hand when you're answering a question. So if you're non-Indigenous, how would you recommend looking into personal connection, or would you recommend it at all?
So what you just asked is a great question, because I get asked it all the time, and I keep forgetting to add that point to this PowerPoint. The thing is, people say, okay, give a personal connection, right? So a personal connection can be, maybe you've done research, right? Does anyone in my family, suffer with something like autism spectrum disorder? No, but I've done research on autism spectrum disorder and disparities and genomics, so I can talk about that. Maybe you've taken a course, maybe you volunteered and you've interacted with these populations. Maybe you were you were volunteering at your local hospital and you had an interaction with this population that was very meaningful to you and you learned something from them. Maybe you saw some holistic healthcare approach. Maybe, I don't know, you are part of some religion where you believe in approaches involving the shaman, or things that can be in parallel to practices practiced by Indigenous peoples. For instance, during my undergraduate career, I did a study abroad in the United States, and as part of that, I had one trip to Arizona, and I visited a museum. It was like an indigenous, I forget the details, but I learned a lot about the Navajo peoples and how sometimes they live 60 miles, so that's like 100 kilometers away from the nearest high school. And, well, once they finish high school, they might not even finish high school, right? Because what are you going to do? You're going to drive 60 miles there, 60 miles back, or you're going to go help your parents make some money so you can live comfortably. And I talked about this kind of stuff because these are the social determinants of health. And lastly, maybe you've read some news and you have some up-to-date knowledge about what's going on, some sort of hot topics. You see how I'm giving like 20 different ways. I'm not an Indigenous person to, Native Canada, but there's like 20 different things I could have talked about. You see that?
Yes, that makes sense. Thank you so much.
Yeah, my pleasure. I hope I inspired your guys' thinking. Okay, let's see how we should approach these personal questions, y'all. You should look at the CanMEDS pillars and have 2 to 3 stories relevant to each pillar, how you show that pillar. I use the AMC list just because I interviewed in the US earlier in the cycle, the second time around when I did this approach. Because, you could be asked any personal question, right? Here's one that'll stump you guys. Name a time you disagreed with a supervisor. That's a crazy question, but you need to have answers to these on deck, or else you're going to be like, oh man, I have no clue, and you might have to make up a story on the spot, which is terrible because it'll sound fake. So what's the biggest challenge you've overcome? Let's look at this question, okay? And by the way, you could be asked like some policy question, and then a follow-up can be a personal question, okay? Think of that too. And I like using the STAR method, STAR. So you guys have probably heard of this. Let's look at an answer in the STAR method. Last semester in the McMaster Biology Society, while organizing a programming skills workshop for first-year students, we encountered an unexpected vendor cancellation, leaving us without crucial materials. I was tasked with swiftly finding a replacement vendor without overshooting our budget. That's your task. Consequently, I quickly researched alternative suppliers, assessed their offerings against our needs, and strategically approached the most promising ones to renegotiate terms suitable for our budget. I used strategies like calling suppliers instead of email to ensure rapid communication. Ultimately, we secured the necessary materials under budget, and the workshop went on without a hitch, earning praise from attendees. That's the result. STAR method. It's a very, very powerful way of delivering your stories in a succinct manner that is easy to understand. Okay, but there's a missing letter. Believe it or not, it's missing a letter. I looked this up online. You won't find the START method. I think I invented it, but you should add a takeaway. All right, you should add a takeaway to your story. And I love to relate it to my future profession. That's what I do. You don't have to do this. But let's look at this. We're going to say the same answer, but our takeaway is going to be, you're going to talk about how basically you use these skills, or how these skills can apply to your future as a medical student or in medicine. So as I pursue a career in medicine, I will continue to draw on such skills to stay collected in rapidly changing situations. Through strong communication skills, along with problem solving, I will continue to ensure team needs are met for the benefit of my future patients. This is beautiful, because this shows that not only did you have, a story, you answered this question in a very mature way, in a very succinct and well understood, understandable way, but you also reflected on this story. And not only did you reflect on it, you thought about how the skills can apply to your future as a doctor or in medicine. I mean, it doesn't get better than this, folks. The thing is, I would have a takeaway for every single type of question, like a conflict resolution question, a collaboration question, a cultural humility question. I would have a different takeaway for every single story or every single question. So if I actually run out of stuff to say at the end, or I could just always add it to the end of my stories in case I needed to. But it's also always a very mature, strong addition to your questions. So I got a question from Ping Yi. To bring up personal stories, how many sentences should you include? Sometimes you only got 2 minutes to answer each. And my question, I mean, I don't think you don't have just 2 minutes on McMaster, right? You have up to 8, but I wouldn't recommend talking for 8 minutes. It's not a sentence thing. I mean, you got to see how you deliver your messages, your answers. But this is a good length. You want to keep them short. A lot of people love getting into details. If there's irrelevant details, I mean, try to cut as much as you can, because it doesn't matter how cool your story is. It does not. You get points for the ART section. This is where you get points. This is where you show those canned meds rules. Okay, you don't get points for curing cancer in, I don't know, Trudeau's office. It's about what skills you used and what you took away from it. So, what am I saying here? Okay, make sure your personal stories reflect your values. So those canned meds roles, I mean, look at them, make sure it reflects your values. Try to connect to your future career if possible. But here's the thing. Try to tie it to the medical school. I mean, I'm not going to say try, but research the heck out of the medical school you're interviewing at. If I were you, I would research all the different clinical sites you can rotate at McMaster, especially during your clerkship phase. I would research all the different, cool electives you can take or whatnot. Unique things that are going on at McMaster. For example, if you're asked a question like on antimicrobial resistance, what should we do to handle antimicrobial, antibiotic resistance from a public health lens, you could give an answer and then at the very end say something like, oh, by the way, I know that McMaster at I think it's the MDCL building, right? The MDCL building on the 3rd floor has one of Canada's premier antibiotic resistance research laboratories. And as a medical student, I would love to collaborate, in research or contribute to research in Dr. Something's lab or something. Or what if you're asked again, a question about some sort of underserved population, okay? And you can say, hey, I know that one of McMaster's clinical rotation sites, I can choose to go here where there's a big presence of that population. And I would love to do that to learn more about how to best serve them as a medical student. So this is beautiful. No one's doing this. No one is researching the medical schools that deeply. I did this because I was interviewing in the US the second time around, and you do want to, everybody researches the med school because you got to convince them you want to go there too. Now, but regardless, I was able to, for every single interview in Canada, I was able to mention something cool about the school as part of my interview, as it related to one of the questions I was asked. So do that, especially because you guys have a lot of time, right? You have till March. Jack in the Box asks, do we always need to take a stance on questions? Yeah, honestly, Jack, here's the thing, right? Here's my opinion. You want to sound confident in your answers, okay? Now, you can always address other points of view and say, hey, these are also good points on the other end. But at the end of the day, you need to have some sort of grounded answer and opinion. That is the general consensus. So, okay, let's go to some pro tips. I'm going to blaze through these guys. I want to get to the high yield ethics. That really is fun for me. Organization, yeah. Make sure your answers are organized. I would always give some sort of background to my answer, and then I would, give an organizing sentence. I'll begin by addressing the pros and cons of implementing such a public health policy before giving my opinion and then relating to an experience I've had in the area. Boom. When you say this, an experience you've had in the area, it makes people like, wow, like excited, right? Because they've heard the same answer to the same question like 100 times, but if you're able to provide some sort of uniqueness, it gets them excited. Now, what was I going to say? Yeah, first impressions are critical. I mean, these are real people looking at your answers, looking at you answer. Avoid extreme stances. So to Jack's point, perhaps, people say, okay, Kevin, why would I say crazy stuff in my interview, right? I prepared this long. Why would I start saying crazy stuff? But it's not that simple. For example, what if you're asked, should pharmaceutical companies be allowed to provide gifts such as free samples of their latest medicinal compounds to physicians? Most people I know would say, no, this is a conflict of interest, guys. You can't do this. Conflict of interest. Pharma companies, super evil, right? Well, what if this pharma company, okay, what about this? What if you're a family doctor and your patient can't afford a certain medication, but this pharma company happens to give you a few boxes of this stuff, and now you can give it to your students for free. And now your students, your patients. Well, that happened to me, right? I needed something, or my family doc thought I needed omeprazole, which is a gastric, it's a medication, it's a proton pump inhibitor for gastric reflux. So he's like, oh, by the way, this company sent me like 3 boxes of this stuff. Here you go. So I don't have to pay for it. Now, did I need omeprazole? No, I didn't. But that's a different story. In Canada, you don't have pharmacare. So when you go to the doctor, medical care is free at the point of service, necessary medical care, but your prescription medications, your antibiotics, these are not free. Usually you have your mom or dad's insurance or something, or maybe you work, but you pay for those. So in Canada, I mean, it's a very real thing. You have free samples, you can give it to your patients now. Or what if this pharma company is a big part of your local economy, and now because of some sort of laws, you can't have this interaction between pharma companies and doctors, and now it goes bankrupt. That company goes bankrupt, everybody gets laid off. I mean, you don't want that, right? You don't have to agree with this, but if you can acknowledge the points on the other side, it will go very far in showing your maturity. Okay, study at night. This is a topic like I just talk about sometimes. If you study at night, you remember things better. I got this from this book when I was a teenager. It's like you remember things 6 times more if you read it 45 minutes before you sleep. I don't know how true that number is, but I believe it because, if you watch a horror movie at night, you're going to have nightmares. If you watch it in the morning, there's a good chance you won't have nightmares. That's why cramming the night before a test is not, the worst. Okay, let's just keep going. Share videos of answers with colleagues. Okay, so to this point, so in our question banks, you can go on a question. Okay, it's a free account. I'm going to paid account soon. Okay, create a test, begin. So how does medicine contribute to climate change, and what changes should be made to reduce medicine's impact on the climate? Okay, I'm going to begin my response. Let's connect to my phone. Let's connect. So finish. You can save this video. Okay, let's go to the next. I think, yeah, disconnected. Okay, begin response. How should we take? Okay, guys, this is kind of crazy. I don't know. I don't know what camera it's connected to, but yeah, you can record yourself and then you can send these videos to your friends. You can save them and so on and so forth. Okay, let's get back here. Why do you want to do that? Because a lot of times with personal questions, it makes sense to you, but it doesn't make sense to anybody else. With the stories that people provide, like they'll provide. Sorry, let me get out of this. People will provide some crazy. Sorry. People will provide a lot of crazy details from their personal life stories, but they will never make sense to anybody who's not their friend or their family member. So that's why you want to take videos. Okay, practice. Let's get to the high yield ethics stuff. Okay. So a lot of people, they trip out over high yield over ethics. So this is why I presented to you guys in a very condensed manner, so you can save your time on other stuff. So organ donation, people go crazy over this. I don't know why. I would simply know about the opt-out versus opt-in model of organ donation. So in North America, it's opt-out, it's opt-in. You're not an organ donor when you're born. You have to opt in to be one. Other places, it's opt-out, right? You don't want to be an organ donor? Okay, just opt out. Thing is, people are complacent, right? They're not going to go opt in or opt out. So if you just automatically make it one thing, it can have very real effects on what happens in your healthcare system. So generally, opt out is seen as like better because you'll have more organ donors and it'll help the wait lists. Some countries have a marketplace, so you can perhaps talk about exploitation. And then there's considerations of like autonomy. So autonomy meaning, if you're really free to make your own choice, because what if you have a family member and they're begging you, right? So are you really making a choice because you want to or because of external influences? So I would know those things. Climate change, you can know the effects of medicine. For example, tons of medical waste is created. I mean, if you've ever shadowed inside an operating room, you'll notice like, oh, how much gloves we use, how much just random stuff we use. You can relate to indigenous health, for instance. A lot of indigenous peoples, the environment is a big part of their identity, right? So it becomes a topic of social determinants of health with mental health and so on and so forth. Synthetic biology, I mean, that's a really cool topic. You guys can look that up yourselves. But you can basically engineer bacteria to serve the climate. Preventive medicine, you can talk about preventive medicine and how a bad climate, I mean, from a preventive medicine point of view, it exposes you to lung cancer and so on and so forth, worse health outcomes. And you can talk about the social terms of health, what it means to live in a polluted area, access to air filters, and so on and so forth. AI in healthcare, I would definitely know the risk of bias. The thing is, this is what everybody's going to talk about. So if you can talk more than that, mention cooler ideas, I mean, you're going to get ahead. Risk of bias just means making sure the data you train on, the models you train, that you have representative data from all sorts of people, population, sexes, I mean, BMIs, everything, right? You want to have everything there. So your AI models aren't biased or they don't perpetuate bias. I mean, these are the lines of thinking that if I were you, I would know. You could talk about the use of natural language processing like ChatGPT and so on in analyzing medical records, electronic health records. You can talk about data security. For example, last year, a Toronto hospital was basically hijacked and some hackers paralyzed the entire medical record system and said, we want like 3 Bitcoins or what, I don't know, 10 Bitcoins for us to unfreeze your systems. So you could talk about that, the risks there. Quantum computing, breaking encryption, that's like some crazy topic. I wouldn't bother too much with that, but basically encryption can be broken, in the next decade or two with quantum computers. So you could look that up. Privatization of healthcare, this is huge in Ontario. So there's a healthcare worker shortage. You can talk about the long backlogs of elective surgeries like cataract, hip surgeries. You could talk about whether you're for or against it. Now, the thing is, you got to acknowledge, right? Because a lot of people automatically go, I'm against it because these private companies are going to make so much money. You can also talk about family doctors. I mean, family doctors can have their own private practices in Ontario. you can't charge arbitrarily high prices. You can only charge the OHIP standardized prices. So whether it's a hospital or private practice, they're billing OHIP at the same rate. You can't, even if someone's not paying with OHIP, they can't, the practice can't charge them more than what OHIP's rate would be. Okay, so that's cool to know. You could compare it to other states, other provinces. What I meant is other provinces like Saskatchewan already lets you do some of this private stuff with the elective surgeries, see what's going on in Saskatchewan. Is it working? Is it not? You can talk about, okay, maybe you don't agree. It could create a two-tier healthcare system, right? You can talk about other countries and their healthcare systems. Germany has this like private, public kind of split. Yeah, you could talk about COVID-19 exacerbations in terms of the healthcare worker shortage. I wanted to mention something. I forgot. Sorry, y'all. Forgot. All right. Homelessness. Know some cool stuff about the complex housing initiatives in Ontario. Look into initiatives in Toronto. Okay, so rehabilitation and re-entry into workforce initiatives, social returns to health, connections to opioid crisis, vaccine ethics. Okay, know some stuff about this. I mean, this was pretty hot a year or two ago. I don't know about now. They could still ask you about it. Vaccine hesitancy. Know the 5 stages of change. I talked about this very in depth at our medical school interview summit, where we had 5 other guest speakers in addition to me. We're gonna have the recording for that up soon. I would definitely check that out if I were you guys. But I've been asked many times, like, oh, this, you're talking to a patient who's a chronic smoker, or your friend, is vaccine hesitant. And as part of my interview, I have to talk with them. Okay, so this could happen at McMaster. I mean, you guys aren't safe from this, just because it's like a synchronous interview. But yeah, you could be asked to like talk to somebody as like a kind of MMI communication question. And this framework will really help you. If you guys want, at the very end, I can go to that other presentation and show you what I said about that. But we have the recording. Scope expansion. So this is what I talked about with like, the mid-level providers. I wouldn't call them that if I were you. It's not politically correct, but it is a very colloquial term that most people would understand if you're going to look stuff up. You could talk about DOs. There's a lot of, I think Alberta is letting DO graduates, which is like different than MD, but you can do the same stuff in the US, come to Alberta with minimal other training. You could talk about accelerated pathways for internationally trained physicians and whether we should do that to address our physician shortage. Mental health. You could talk about the current crisis, especially among youth. I mean, I've had so many medical school interview questions where it's like, oh, how should we tackle social media, mental health problems in youth, or some sort of stuff like that, right? You talk about the elderly population. It's going to be huge, guys, huge. So many questions have been asked. How should we address an aging population? Because, I mean, that's the hot topic across the world these days, is what do we do with an aging population with increasing prevalence of chronic diseases like Alzheimer's, dementia, diabetes. Yeah, Jack, I would, if I were you, honestly, you could be asked about some crazy like real-time events like tariffs. Okay. Ask me at the end like what my opinion is. I could give you some pointers off the top of my head. Yeah, role of medications, right? Like SSRIs, antidepressants and so on and so forth. Are we overprescribing, underprescribing? What role do these have? And access to therapy. You could talk about like telehealth and stuff like that. Medical assistance, medically assisted dying. I forgot what the I stands for. Medically assisted something dying. Guys, I forgot. It's been 2 years. But this is basically, I've never been asked about this. Okay, so I think this is one of those things that's like the boogeyman. Oh, you're going to be asked about medically assisted dying. I've never been asked about medically assisted dying over like 15 interviews, right? It's one of those things like organ donation. People are just infatuated with it. Although, what I would know is the basics of the Canadian law around this, the changes that were made in 2021. So there's like a slippery slope argument, because now it's like, okay, we're allowing certain mental health conditions to be allowed. Okay, are we going to keep going? Are we going to allow children, right, with certain chronic conditions or fatal conditions? So are we going to keep pushing this in some sort of direction? Can it become slippery slope? There's religious religion considerations, how what different people believe. There's also autonomy, if a patient wants it, the patient is able to make their own decisions, they're capable of making their own healthcare decisions, should they be able to do it. Indigenous care, we've hit this several times, but again, know basics about the history of colonization, rural health, cultural competency, understand, that they believe in a holistic approach to health that is not just allopathic in terms of medicine, which is, prescribed, diagnosed, but it involves spiritual matters, a shaman. You could always bring in a community leader into the hospital and have them mediate, be a liaison between you and the patient. And again, there's social determinants of health, because there's a lot to be said about their social determinants of health. Communication of scientific knowledge. I've been asked this many times. How should we best create a campaign or disseminate knowledge on this or that? And medical assistance in dying. Okay, so the I stood for in. Dana clarified. Thank you, Dana. Public health, modes of communication. So I had this might have been a McMaster. Actually, I can't say that. This was not a McMaster interview, guys. It was not. But there was a question about disseminating some sort of information to elderly folk. And it's how should we do this? So this was the first cycle I applied. My boy, he gave a pretty cool answer, because we discussed after, yo, what'd you say? And he was like, if you're going to address the younger population, it would be through social media or XYZ, but older folks, maybe radio. And we have a very diverse population in Ontario. For instance, we might have to disseminate this information in different languages, go to different community centers. I mean, there's Chinese community centers, maybe through different social networks like WeChat or the Russian one. There's different social networks that can be used. And he really went into depth about the multicultural aspect. So he didn't just say, okay, we're gonna, use newspapers for old people, but he started talking about different languages, radio. Other people may not be able to read. Different people may not be able to have, may speak different languages, and so on and so forth. Misinformation, battling mistrust, evidence-based medicine. Yeah, misinformation I've been asked a few times. I don't know if it's that hot of a topic right now, but you could always be asked about that. Aging population, so the tax system. Understand that we have a smaller workforce paying for social benefits for a growing elderly population. What's that going to do to our social services, fund, so to say? Ageism. I think I've been asked one question about ageism. It's the discriminatory actions towards people based on their age. I mean, you could look up a few pointers there, but you should say, okay, a lot of people, when they reach those elderly ages, it affects their mental health. They're not involved as much in their communities. They're disregarded more, and so on and so forth. Telehealth, how that can help. Loneliness problems, wealth transfer, medical assistance in dying, resource allocation, and anti-senescence. So this is a hot topic. You could be asked about this. Anti-senescence there's a lot of technologies coming out to prolong life. I mean, prolong disease-free life, whether it's turning back the time clock at the epigenetic level, at the cellular level. So people are living longer. And what does that mean? Again, for our population, for our healthcare system, and so on and so forth. We're seeing diseases we haven't seen before just because people are living longer. Global health. So global health usually comes around the angle of infectious diseases or the role of wealthy countries in supporting, less wealthy countries. So there's, stuff like some hot topics, right? Like the US pulling out of the WHO, for example. What is the role of wealthier countries, right? Should we first try to disseminate these vaccines or these aids to our own populations? Or should we have some sort of system for getting it around? What do you think is equitable, right? Because what affects, the other part of the world, one day or another could affect us, like in the case of COVID. The influence of politics, you could talk about, for instance, I think the US, it was almost a decade ago, sent a big care package to Venezuela, and the government just burned it. It was a political statement on the Venezuelan government's behalf. And I mean, should the U.S. have spent that? Like you get what I mean? There's politics involved. I wouldn't be too overly political, but you can mention, hey, people could be making political statements and so on. Prioritizing one's own citizens and potential for malice. School and tuition. This is a very cool topic. Okay, so pay attention. Should medical school tuition be free or taxpayer funded? Think of that. Think of what your answer is to that. You could also mention several schools in the U.S. are free now, but it's not like taxpayer funded. It's actually these philanthropic donations from wealthy alumni or business individuals. But if we're going to make med school free, what about law schools, right? What about other schools? Why should med schools be free? Why should someone who goes into the trades fund education for someone who's going to med school? Like, there's a lot of things to talk about. But then here's the cool part, right? Here's the cool part. The argument is, if you make medical school cheaper or free beyond what it is right now, you'll have less incentive for people to go into very specialized fields. And we have a primary care shortage, guys, okay? Because it's like, oh, I don't need to go into ophthalmology to make $500K a year because I don't have, $300K in loans anymore. Medical school is free. I barely have any loans. So that's the topic there. So whether you're asked specifically this question, or you can integrate this, especially if it's like a primary care shortage question, you could integrate this kind of idea. Relevance of grades. We're seeing more and more Queens, TMU, all these schools not look at, for instance, your MCAT, not look at this or that, or do a lottery system. So have an opinion on this, guys. Have an opinion on this stuff if you think it helps remove barriers to access, make it more equitable for people, and so on and so forth. Yeah. So yeah, some places like McMaster, they don't even let you mention your extracurriculars. Standardized tests versus subjective. Yeah, is the MCAT standardized? Guys, this is some super crazy information. No one has this. In fact, I might be the first person in the world to break it to you. I was at a conference at the AAMC. Okay, I'll answer you in a second, Naya. I was at the conference in the AMC, and the people with the AFMC. Let me pull this stuff up, guys. This is some crazy information. Boom. Okay. AFMC Canada. Okay, so this. Have you guys heard about how the US and Canada aren't considered equivalent anymore in medical education starting 2026? Basically, if you got a US medical degree, it'll be considered international for Canadian residency applications and vice versa. Who's heard of this? Just put in the chat. Who's heard of this? Yes. Okay, Jack in the Box heard of this. Not even Caribbean. Okay, Caribbean was always considered IMG. It was always considered IMG. It was never considered. Yeah, so we have a really good article about this. Okay, let's go to breakdown through blog. Guys, I need to hurry up. Sorry. Yeah, we have an article about this. Basically, I spoke with the people at they were there at the conference I was at. It was like a national US medical student conference, and the people from the AFMC were there. Yeah, or the EACG, I don't know, whatever the acronym is. And they basically said they said they're trying to move away from the MCAT. I don't know if anyone's broken this information before, but Canada, I mean, these people who are in charge are trying to move away from the MCAT. And they said that the reason they did this, Canada was part of wanting to do this, like getting out of this, because they said, well, in Canada, we have a more social justice approach. We have parts of our curriculum that we want to dedicate to Indigenous populations and so on and so forth. So having a U.S. accreditation agency come in every single year and accredit our Canadian schools, I mean, they didn't see that was the way they wanted to go forward. So, and they're also saying, yeah, we need to perhaps remove the MCAT. I mean, it's an American test. It'll ask you sometimes about like Medicare or whatever. So yeah, very cool information there, guys. Okay, let's quickly go through this. LGBTQ population. So understand techniques you would want to use, especially if you're not part of this population. How to talk to people just different from different life backgrounds and social backgrounds. You want to use preferred pronouns. You want to make a safe and welcoming environment for them, right? Maybe you want to advocate for use of training in the work environment. They have their own sets of health concerns, for instance, and you can talk about intersectionality, aging population, tax system, ageism. I don't know why I did that again. And again, some quick facts. International graduates, you can talk about retraining, residency spots. We're going to send these to you guys. I think I talked about housing crisis, doctor shortage, and genomes. The thing is, you could like not study, for example, doctor shortage, but if you studied international graduates, right? Or if you studied, the recent changes for for IMG or for mid-level providers, then you could just talk a lot about you have a lot of stuff to talk about here if you're asked about the doctor shortage. You didn't explicitly study for it, but just by having a lot of background on other topics, it'll stick. Okay, so subscription credit will be sent promptly after this webinar. So the point of that is, guys, the best way to improve in these questions and your answering ability is to do practice question after practice question after practice question. So we have over 335 questions, guys. 335 questions with expert answers from medical students. Now, the thing is, the point of this, people ask, okay, well, I could Google and research these answers online. Well, yeah, but you're going to spend dozens, if not hundreds of hours doing it. The point is, if you're going to get ahead of the population, the idea is that all these answers are in one place. We paid medical students, right? We paid them to give us their answers. Let's see, what are your interests and hobbies outside of your academic and career endeavors? We paid them. See, there's several answers for these personal questions. For personal stock questions, we have purchased several answers for each of these. So you have expert answers from medical students, tips to go beyond, red flags to avoid for over 300 questions. What do you believe will be one of the most important challenges that future physicians will face? View, answer, see, and we have multiple for this too. There's not multiple for all of them, but a lot of them have multiple. Hot topics, like I showed you, alternative medicine, social alternatives of health, malpractice, AI in healthcare. I would certainly brush up on these for your interviews, but we also have updated for 25 Ontario health policy mini banks. But here's the thing, you might be like, oh, I'm interviewing at McMaster. I'm just going to do this. If I were you, I would also do British Columbia. I would also do Alberta. I wouldn't pay as much attention to it, but there's a lot of times you'll find some cool tidbits of knowledge from other provinces that you can be like, oh, well, my opinion on this policy is this, but here's what Alberta's doing. Here's what Saskatchewan's doing, and so on and so forth. So yeah, there's 30 questions in the Ontario Bank. Let's click create test. What are key reforms Ontario has implemented in prescription drug management? How have they affected patient care? So would I take notes if I were you? I mean, you get unlimited resets. So, and it's real-time research knowledge, like the Interim Federal Health Program. How has Ontario addressed health inequities among immigrant and refugee populations, and what additional policy could be implemented? So we have real-time research knowledge for you guys, so you don't have to spend your time doing this. And again, like I said, 50% of the interview is just how you deliver your answers. So that is going to be very, very useful for you. And if I were you, I would briefly take a look at the American health policy one, because there's some times where you can be like, oh, that's such a weird fact about how the US does this. And you can mention that in your interviews, or another country. I mean, you could just look at different countries. I wouldn't spend the most time about that. I actually have like a PDF I made, like 10 pages about a lot of the OECD countries and main points about their healthcare systems. And I might clean that up in the next 2 weeks and send it to you guys just for free, because I think that's a very interesting thing, or just post it online. If I don't do that, just someone text me or email us and I'll do it. So, and lastly, because that demo didn't work because it was connected to my phone. Here, let's go on test mode. Allow, begin. Describe a time you showed leadership, begin response. So here, you want to record yourself. You want to make sure you're talking to the camera, speaking with confidence. Finish. Begin. You can save these videos. And again, we have answers, top tips to go beyond, and red flags to avoid. So we'll be sending you a subscription credit to your emails along with the slides right after this webinar. Where's the U of T meeting uploaded? I'm not sure if it's up yet. Did we do a U of T session? I don't know. We have 2 webinars we still need to edit, and they'll be up very soon. New. Zobia, they removed the MCAT now. Who removed the MCAT? Which were you talking about? All right, guys, are there questions for me? Yeah, TMU did, I know. Are there questions for me? There were two things I swore I was going to talk to you guys about at the end. If you remember, just tell me. If you want to hear me talk about it. Otherwise, just put in your questions. How can we access slides and recordings? Oh yeah. So if you want to access the recording, all you got to do is make a free account on thebrightdoctor.com. Just log in to thebrightdoctor.com, make a free account, and it'll be under past webinars. And these will all be for free. You can access them. Okay. If you really like the high yield ethics section, I spoke about it at the TMU. You could access it right now on the TMU webinar. Okay. Naya had a core. Naya asks, let's see. Sorry, Naya, I can't find your question. Would it be bad to say something like looking at MCAT scores is bad, especially if we're interviewing at a school that uses them? So Naya, it is very much your opinion. So I wouldn't say it's bad. I mean, I know what you're getting at. You want to take a stance against it. Now, the thing is, you also don't know what the opinion of the person is. But if you can, my answer to that would be, hey, we need to have certain subjective measures of academic success for medical school because, hey, we're going to have to take boards, we're going to have to take standardized exams, and we need to ensure that the people we're admitting are able to pass those exams, they're able to succeed in medical school, or else we're really doing them a disservice. I mean, if we're going to accept people who we know will not do well, we're doing them a disservice. But then you can mention your opinion. Is the MCAT the right assessment for that? Maybe you think it is. Oh, it incorporates biology knowledge, it incorporates this and that. Maybe Canada, I know Canada pulled out of this. Like I told you guys that crazy information. Maybe we should have our own standardized exam. Why are we using, do we use the SAT when we apply to university? No, why are we using the American version? You can have your own nuanced opinion, but again, be balanced and don't be like, oh, no, screw the MCAT. Well, if you do, if you do want to go that way, I mean, you can. You should talk about Ottawa, and the difference Ottawa uses. Okay, maybe we don't look at the MCAT, but we put more emphasis on this. But what is TMU doing, and so on and so forth. I mean, it really the world's your oyster, but just make sure you substantiate your points well with real world knowledge. You mentioned speaking about tariffs at the end. Okay, so tariffs. What I think about tariffs. I mean, guys, tariffs, I'm not an economist, but it'll have an effect on the workforce. Yeah, guys, I don't know. We'll see. I live in the US now. I don't know. Tariffs will definitely raise the cost of living, make it more unaffordable. There's already a housing crisis. Now, the housing bubble is starting to, rent is starting to get cheaper because there's more supply on the supply side. A lot of people are leaving Canada. Many visas are set to expire. You could talk about how the tariffs will. Oh, guys, I don't know. Sorry, I don't actually have a good point there. Have you done asynchronous interviews? Yeah, I mean, I did Queen's. Queen's first part was asynchronous. McGill was not asynchronous. Ottawa was not. Queen's second part was not. What else did I do? McMaster's not. Yeah, I think Queen's first part was the only asynchronous interview I did. How do you prepare for an asynchronous interview? I mean, it's the same way you prepare for the CASPER, especially focus on recording yourself. The thing I love about expert answers is if you miss something, you can read it. And now you don't have to spend hours and hours. I mean, guys, time is very valuable, and you want to spend that improving at the delivery of your answers. I say this a lot. I like to talk like a talk show host when I interview. I'm going to give an example, okay? So in my interviews, I love talking. A big thing I changed the second time I interviewed is I started talking like a talk show host. It's what I call it. So imagine there's a question on AI in healthcare. How can we ensure that as AI systems are developed and integrated into medical practices, that they don't neglect our underserved populations, okay? So the first time I interviewed, I would have said something like, well, this is a very important question. Nowadays, we're using AI more and more in the healthcare domain. And if we're going to use AI, we need to make sure that our AI is not biased. This means that AI models, when they're trained, need to have a very representative set of data that they train on, because ultimately AI models see the patterns in the data that they're trained on and use that to make future predictions. So for instance, if we have an AI model that is not trained on, say, Asian populations, it cannot generalize well and be sufficient for diagnosing or treating AI, Asian populations or Black populations, or name the population. So is what I said bad? No. It's actually a very textbook answer. It's a very solid answer. But watch what I started doing just the second time. Okay, the second time, I would say the same stuff, but I'd say something like this. Right. Well, AI. I mean, this is the question of our era, right? Of our generation. Every single day, we see more and more. We're using ChatGPT, natural language processing, in looking at medical records. We're using AI to look at EKGs, okay, to make recommendations for hospital internists to prescribe ACE inhibitors, blood pressure medications. And we need to make sure, if we're going to start using AI and trusting it this heavily, because remember, trusting it this heavily, we got to make sure that it's trained on data from a very diverse population. In Canada, we have people here from all over the world, okay? AI, the way it works is, well, the data used to train it will influence its predictive outputs. So imagine we don't train, or we don't have a representative data set of maybe Indigenous populations or Black populations, then our model will not be able to serve them well. You see what I'm saying? You see the difference? It's like I'm explaining something to somebody. You guys see the difference or no? Just put in the chat yes or no. If I should explain that better. Yeah, much more animated. Okay, so the thing is, what I like to do, we'll go online, find some speaker, some political person, or some internet personality, and try to emulate their way of talking. Because I think if you it exudes confidence when you're talking like you're teaching a class, like you're Sal from Khan Academy, you're teaching somebody, and it's a very more charismatic way of talking. It's my style. I mean, it might not work for you, but that's one thing I think helped a lot. Okay, you mentioned about tariffs. Okay, in what order should we preparize our prep? So in your prep, guys, it's kind of like you roll. Okay, like I would do a lot of questions, just see a lot of different questions, see answers to a lot of different questions. I would spend like 2 or 3 days just like thinking of personal stories from your life. That's a huge one. Writing them down in the start format, okay, because that's going to help you a lot. And the only way you're going to know if you're missing stories is by doing a lot of personal stories. So you could just go in the personal section here. Here, it's like you can unclick stuff. I'm going to go to the personal section, and then you're going to see, okay, well, it's the biggest challenge to overcome or whatever. Why do you want to be a doctor, not a nurse? I've been asked this in Canadian interviews. I've been asked this in American interviews, okay? So you want to have answers to these personal style questions. And besides that, I mean, in the evenings, listen to the cool stuff while you're at the gym, listen to cool podcasts, gain some more perspectives. And the beauty of studying this, like people stress, like, yo, do I need to like study every single point about alternative medicine or opioid crisis? Well, no, because you only have 8 minutes to talk, right? Or really 4 minutes to give your first answer. 3 minutes is what I did. But as you keep learning and learning, cool points will stick to your head and they'll come out very naturally in your interview. Did that answer your question, Jazia? Zobia asks, what about Trump saying there are only 2 genders? How does that impact Canada? I mean, I don't know if they're going to pull in stuff that inflammatory into your interviews, because this is like, it's not even Canadian politics. It's U.S. politics. You know what I mean? I'm going to say something because I live in the U.S. Canadians love to believe U.S. politics is part of their politics, but you're a distance from it a little bit. Although economically, yeah, you are very intertwined with the U.S. I'm saying you. I'm a Canadian. I don't know why I'm saying you. I'm a Canadian too. I wouldn't worry too much about that, but have an opinion on, what that means for patient care, for of all sorts. I'm not going to get too much into it, but have a nuanced opinion on what you think of how it could impact patients and maybe rippling effects it could have into Canada. But again, this is U.S. politics, guys. That's not a Canadian healthcare thing right now. Suji asks, could you speak about your experience with the role play station for the MMI? Yeah, it was, I think, I can't say. Okay, screw it. I don't even live in Canada anymore. It was like a vaccine question. I forget the school, but it's like this person's vaccine hesitant. I mean, that was the gist of it. And you have to speak with them. So what you want to use in those situations is, I love the stages of change model, okay? You guys are just going to have to wait 1 minute while I pull this up, because I made a really good slide deck on this. It's like 2 slides. It's not long. I'm going to answer the next question while I pull it up. Okay, so we can talk about Trudeau's. Okay, that's not even. Ananya asks, at the McMI, would you say there's more policy ethics than personal questions? I mean, it was so random, guys. McMaster's was so random. There's some policy, there's some personal questions. It is truly an MMI. I mean, you could be asked anything. I wouldn't spend all your time doing one or the other. It can truly be anything. Okay, the next person asks, you mentioned discussing immigration and international students. Yeah, what did I mention, Jazia? Could you run that back? Like, what do you mean by that? Okay, let me pull these slides out for the communication questions, okay? Okay, communication, the key point is you always want to assess understanding is something I like doing. Assessing understanding. But these are slides from our Canadian Interview Summit. We had 6 guest speakers come on board from different medical schools. We had Sarah from U of T and so on and so forth. Anyways, motivational interviewing. So this is really interesting. And I think the best way here. So for example, your friend Elliot expresses concern with getting vaccines, citing information they saw online. Consequently, they might not be able to perform their clinical rotation at external sites. So in a panel interview, you might be asked, okay, you're the friend and you got to talk to Elliot. But in an MMI, you could still be asked, how would you approach the scenario? It doesn't matter if it's asynchronous. It doesn't matter if it's synchronous. I've had this across all sorts of interviews. So you got to know the same basic techniques for interviewing, sort of motivational interviewing or communicating. And guys, this is like a very respected framework in medicine. We get tested on this in US board exams, okay? The stages of change. You want to move the person to the next stage of change when it comes to these kind of questions. So if they're not even considering it, get them to consider it. Raise awareness. If they're contemplating it, get them to make a plan, right? And so on and so forth. And I have a personal story about this. I was doing a clinical afternoon thing after one of my classes last year, and I had to basically take a history from a patient and talk to them. And during the history, I mean, they came in for some other thing, but I found out they were smoking. You know, this patient's a smoker. So I go to my my attending, and they're like, go do some motivational interviewing on them and see what you can do. So I spoke with them. I'm like, well, you know, have you ever thought about quitting smoking? And they were like, yeah, but I'm not interested in doing that. I've tried it. I'm not interested. Okay. So what stage are they at? They're at pre-contemplation. They're not even considering quitting right now. Okay. So this is the stage they're at. So the goal is to move into the next stage, and you got to raise awareness. So guys, I'm not going to act like I'm some magician, but the correct thing to say here is, oh, well, what are some reasons why you think quitting smoking would be important? That's literally like the correct thing to say in terms of this interview style. And I looked it up, and I literally said this to the patient. And the patient said, well, you know, I have a family history of lung cancer and my grandfather passed away or something. I don't know. I don't remember the specifics, but they mentioned that. And boom, that's all you got to do for that visit. That's all you got to do. Just move them to the next stage. So you sparked something in their brain like, hey, there are reasons why I might want to quit smoking. So, and then I said, okay, well, thank you, and and whatnot. And to really drive the point home, here's a UWorld question from the step 1 question bank. Okay, this is like US board exams. A 52-year-old comes into the office for routine follow-up appointment. The patient has a history of well-controlled hypertension and hyperlipidemia. 35-pack year smoking history, and so on and so forth. Father died from a stroke at age 65. Family history significant for lung cancer. When asked about whether he has considered quitting smoking, the patient replies that he's not ready to stop smoking. He says, I know I probably should, but I'm too stressed at work to give up my cigarettes right now. To be honest, I'm probably smoking closer to a pack a day. Okay, he's too stressed. So this is, again, the former. Here, okay, you want to move into the next stage, all right? So what's the answer here? What do you do? I suggest you consider how your health may improve if you were to stop smoking. See, no one even picked this. I understand that you're under a lot of stress, but you're capable of more than what you think. So guys, these are like nice things to say. And by all means, go and say them. But in terms of the stages of change, what do you worry will happen if you quit smoking? What about if you don't quit? So it's literally what I said to that patient that I spoke about. But for some reason, I didn't pick that. But again, I should not have doubted myself. This is the correct thing to say, is to get them to start contemplating. And if there's medical professionals, they will be very familiar with this framework. So you could use this. Not all your communication questions will use this, but this is very cool, okay? Just because you guys stayed later, I gave you guys some bonus lessons. Okay, other questions? You mentioned that immigration topic is big in Canada right now, and then you can touch on how to tie that with international students in medicine later. Well, yeah, I mean, in Canada, you have a very diverse population. There's a lot of benefit to bringing in internationally trained individuals, right? I'm a Persian dude. My parents want to go to a Persian doctor, you know? They just understand things better for them. But at the same time, you have unmatched graduates from Canadian medical schools. Should that be a thing, right? Why are Canadian medical graduates going unmatched? But you know, there's spots for international medical graduates. Guys, this is the craziest thing I learned, okay? It's the craziest thing I learned. Did you know that the UAE purchases residency spots in Canada that are only for UAE nationals, so the Emiratis, and they come here, do residency in Canada, and then they go back. And they don't stay here. I mean, you could, from one angle, you could say they don't contribute to, you know, practicing medicine here. So you could talk about that. I mean, they literally they fly them in, they purchase the residency spots, and they don't have to compete with Canadians for those residency spots. They have to just compete within themselves, within that country. And yeah, they fly into Canada. They have funds, exactly. They pay for their housing, they pay for their everything. But then the deal is they have to go back to the UAE and kind of, you know, bring the lessons they learned from Canadian healthcare. So yeah, guys, you have so much to talk about, guys. I actually met a lot of these people at a conference one time. Very interesting people. Very very cool. Very cool how loyal they are to their country. It was very interesting talking to them. All right, guys. I think that's about it. We've gone over time. But hey, I wish everybody the very, very best in their medical school interviews, okay? We'll be sending you again. My pleasure, Ryan. We'll be sending you a credit code if you for the Bright Doctor question banks and the slides right after this email. My pleasure, Mariam. My pleasure, Jordo, Suji. My pleasure, Naya. Yeah, I wish everybody the very, very best. You guys have plenty of time to study, so use it and become very strong communicators, okay?